10-year-old Kirsten Barber inherited her bright smile from her parents, Lisa and Derek Barber. She also inherited sickle cell disease, a blood disorder that affects red blood cells and blocks the flow of blood through the body. Kirsten's 4-year-old brother, Christian, also inherited sickle cell disease, but their 2-year-old sister, Courtney, did not. Like her parents, Courtney has sickle cell trait and is a carrier for the disease.
Well, sickle cell disease is a problem with hemoglobin. Hemoglobin is the protein that's inside red blood cells, and it carries oxygen from our lungs to all over our body.
Everybody has red blood cells in their body, and they're kind of this shape. They're round, and they're kind of like a donut, and they're actually very tiny. You have to have a microscope to be able to see them, but they're in your blood, and they carry oxygen in your blood. And normally, they travel through veins and arteries, and pretend this is a blood vessel in your body. It flows through easily, and it's flexible and can bend and squeeze through the tiniest of the blood vessels in your body. With sickle cell disease, the red blood cells are a sickle or a banana kind of shape, and the reason why is they have an abnormal substance called hemoglobin in them that makes them change to this shape, and they are hard and sticky, and when they try to flow through the blood vessels, they get caught, and if you get several of them together, they can get caught on each other and cause kind of a blockage so that the blood can't flow through the veins and arteries as easily as this round normal shape. Children and adults, all people with sickle cell disease, can have interrupted blood flow in their small blood vessels, and that's due to the sickle cells obstructing flow. When there's not enough oxygen being delivered to the tissues, there's a lot of problems, and one of these problems can be pain. Pain and acute painful episodes related to sickle cell disease is the #1 cause for admission to the hospital for children and adults with sickle cell disease. Depending on what part of the body the sickling happens in, there's just different symptoms that can occur. Children with sickle cell disease that have a sickling problem in their brain can actually have a stroke. They can have sickling in their lungs and have what we call acute chest syndrome. They can have sickling in different organs of their body, like their gallbladder or their spleen, and cause damage to other parts of their body.
Kirsten showed no symptoms of sickle cell disease until she was 9 months of age.
She had what was called dactylitis, and the layman's term is hand and foot syndrome, and it's when the hands and the feet swell and they look like, you know, when you go to the doctor's office, they have the rubber gloves and you blow them up. Well, her hands and feet looked like that, and it was very painful for her.
She began receiving daily medication to treat her disease. She experienced only minor problems until she was 9 years old, when she developed chest pains and was rushed to a nearby hospital. Due to the seriousness of her condition, her doctors immediately transferred her to Children's Hospital of Austin, where Kirsten was diagnosed with acute chest syndrome.
A little over 14 days that she was in the hospital, and it was an extremely painful sight because she was sedated, and during that time it looks as if she's dead. When you have multiple machines on a child, tubes going into her chest, going into her mouth, the doctors would tell us, go home and get some rest, go home and get rest, and we were unable to leave her side. The one night that we did decide to go home, I received a call from one of the doctors in the PICU, the Pediatric Intensive Care Unit, and he said, I'm not sure that she's going to make it. You need to get here as soon as possible.
Kirsten was nursed back to health and began taking hydroxyurea, a cancer drug beneficial for sickle cell patients.
Since she has been on the hydroxyurea, she's not had any major problems. So we've been so thankful, and she's just so fortunate that they've come out with that hydroxyurea.
As an infant, Christian remained healthy until he was 15 months of age. One morning at daycare, he doubled up in severe pain and remained curled up until Lisa rushed him to the hospital. Doctors discovered blood poisoning called septicemia in his hip joint. He underwent emergency surgery where doctors inserted a tube into his hip to drain off fluid. The physicians and staff at Children's Hospital of Austin have been an important support system for the Barbers. Kirsten and Christian participate in the Sickle Cell Disease Clinic a well-child clinic for children with sickle cell disease.
The Children's Hospital of Boston Sickle Cell Program plays a large role in educating families regarding sickle cell disease as well as educating patients. This education plays an important role of maintaining health as well as recognizing potential dire situations.
We did do a school visit with Kirsten at her school, and it was a real positive experience. Kirsten helped, in part of our discussion with the class, helped describe what it was like to have blood drawn from her arm, which she does every time she comes to the doctor or to the hospital, and what it was like to have an IV started, things like that. And I really feel like the children in the classroom really did have a better understanding of what she goes through, and now can be more supportive and not afraid of her, not afraid it's not contagious, you know, and have a better understanding of what she's going through and help her out when she's at school.
Kirsten and Christian both experienced some of the best doctors and nurses that we could probably find in the country, in a hospital that's just made for children. It's a wonderful place.